President and Senior Policy Director here at the Committee for Responsible Federal Budget. We are so happy to have all of you joining us here live from Zoom. We're less happy about the occasion, which is that we're a year closer to the insolvency of the Social Security and Medicare trust funds. Just last week, the trustees of both of those programs came out with their reports. And of course, here at the Committee for Responsible Federal Budget, we pay very close attention to them. You can check out our analysis at crfb.org. But the short story is both the hospital insurance and old age trust funds are only 8 years from insolvency. That's when today's youngest retirees turn 70. We cannot guarantee full benefits to even current retirees. Now, I'm really pleased today to have not only a couple of experts, but the brand new Chief Actuary of the Social Security Administration, Karen Glenn. Karen has been working at the Social Security Administration for 18 years, I think, and doing a lot of the actuarial work. But now she's running the whole ship, and we're really excited to hear from her to tell us a little bit about what's going on with these trust funds and what the trustees have found.
Great. Thank you very much for the nice introduction, Mark. And let me try to share my screen. Hang on just a minute. All right, there we go. All right, so I am going to go over a few slides on the results of the Social Security Trustees Report. While Mark is absolutely right that the Medicare Trustees Report was released at the same time, I am going to stick to my lane and cover the Social Security results. So first, just setting some background. What is the legislative mandate for these reports? Number one, we are required to cover the trust fund operations of the last year and also the next 5 years. And sort of bigger picture, the actuarial status of the trust funds. What does that mean? That's really about the ability of the funds to meet the cost of the benefits scheduled in the law with the scheduled revenue and the trust fund reserves that we've got, and the extent to which that scheduled revenue falls short under current law. So that tells you what is the size of the changes that will need to be made in the future. Just a little bit of bragging here. The Office of the Chief Actuary at Social Security Administration has produced this report every year starting in 1941. So for those of you steeped in this world, let's go over the 3 primary changes to the report this year. Number one was a law change. I'm sure most of you have heard about the Social Security Fairness Act. It was enacted on January 5th, 2025, and this law repealed the windfall elimination provision and the government pension offset. The repeal of these provisions increases benefits for many folks who worked in jobs that were not covered by Social Security. So obviously, higher benefits is a worse thing for the trust funds. Another change was to the assumption related to fertility. While we are assuming that the fertility rate will eventually return to 1.9 children per woman, as in last year's report, we are extending the period of time it takes to get there. So in the 2025 Trustees Report, we are assuming that from current low levels of about 1.6, it'll take until 2050 to get back up to that 1.9 level. In last year's report, we assumed that transition would be a little faster, getting there in 2040. And this extension of the period really just reflects the trustees' expectations that it will take a while to get back to those higher rates. Third change for this year was in the assumption for labor share. This is the ratio of total labor compensation to GDP. It is assumed to reach a lower long-term level than in last year's report. And this change was made looking at historical data for that ratio. We'll show that a little bit later on, and just better reflect where the pattern is for that assumption. Just digging in a little bit more to birth rates, that assumption we did change this year. Under the trustees' intermediate assumptions, we do assume that the rate will get back to 1.9 children per woman for the intermediate or best estimate assumptions. That's that middle green line you see on the right side of the page. The trustees also look at two different sets of assumptions, sort of a high cost and a low cost assumption. The higher one is at 2.1 children per woman. The lower is at 1.6 children per woman. That one basically assuming the rates will remain level from the current low levels we're seeing right now. This graph shows you all the way back to 1901. Keep in mind this is by year of birth of the mother. So this starts for women born in 1901, goes all the way through women born in 2046. Obviously, those future women, it is just a projection, it is an assumption. But what you do notice on this graph, on the purple historical line, is the clear evidence of the baby boom, where birth rates reached over 3 per woman. It was actually more like 3.2 for a while. And then there was a significant drop after that. We are now at levels just around 2 for a woman for her whole lifetime. And we could get into a long discussion of the difference between period fertility rates, cohort fertility rates. We won't go there for now, but just know that the trustees do assume that 1.9 level in the long term. A little more on the labor share, as promised. This is, again, the ratio of labor compensation to GDP. As I mentioned, we lowered that level in the long term. You can see over on the right side of the graph, the blue line is what was assumed for the 2024 trustees report. The red is what was assumed in this year's trustees report. So you can see the clear lowering of the level. Obviously, there has been a trend down in this measure over the years. Obviously, jumps up and down depending on economic cycles and other things. You can see this big jump in the early 2000s and another big jump in 2020. As we all know, 2020 was a special year in many ways. But the thing to take away from this graph is the clear downward trend. So the trustees assessed this and decided that going forward, it really made sense to lower that ratio, saying that less of labor compensation, less of GDP is going toward later labor compensation rather than capital. A somewhat good news story this year and over the last few years, disability incidence rates remain at historically low levels. People tend to think of Social Security as a retirement program, but it is also a disability and survivors insurance program. The disability insurance piece of the program is doing very well these days. You can see here on this graph that disability incidence rates have declined quite a bit since the peak in about 2009, 2010. There are many reasons for that drop. We don't really have time to get into that right now, but the trustees do assume a return to more of a long-term historical average in the long term. One thing to note is that the rate that's assumed in the future for the 2025 report is just slightly higher than it was in the 2024 report. And for those of you well versed in Social Security policy, that's due to the implementation of a regulation related to past relevant work, the number of years that can be considered in those disability determinations. So that did have a small effect this year. All right, so the headline news from every trustee's report, as Mark already mentioned, is when do the trust fund reserves become depleted? In this year's report, OASDI, or the OASI and DI combined reserves, are expected to become depleted in 2034. That is 1 year sooner than in last year's report, basically due to the factors we mentioned already. The Social Security Fairness Act, the change in the fertility rate, although that one does not have too much impact on the depletion date because fertility rates matter more in the longer term. So that's really got a small effect on the year change. And the other one is the reduction in the assumption for the labor share. OASI by itself becomes depleted in 2033. That's the same calendar year as we projected in last year's report, although it is 3 calendar quarters earlier in this year's report. So while it was at the very end of 2033 in last year's report, we are projecting it will be very early in 2033 this year. And finally, as mentioned, DI is in really good shape at the moment. We do not project that it will become depleted over the 75-year long-range period. All right, to kind of emphasize the overall OASDI reserve depletion, this graph, the blue line, just shows which year we are projecting in each trustees report. So starting in 1991, going all the way to 2025, these are the years we were projecting for that combined reserve depletion. This diagonal line here just emphasizes the year of each trustees report. A couple things to note. Number one, since 1991, that combined reserve depletion date has varied from 2029 to 2042, more fluctuation at the beginning of the period. But over the last 14 years, it's fallen in that very narrow window of 2033 to 2035. So the projections that the trustees are putting out have been very stable. The other thing to note is that the difference between these two lines is how far away we are from reserve depletion. So as time marches on, even if we are stable in the year we're projecting, we are getting ever closer to the time when reserves will become depleted. I am not going to go over all the numbers in this slide, but just so you know, another measure we tend to use is over the 75 years projection period, the actuarial balance for the program. This year, we are estimating that the actuarial balance is a minus 3.82% of taxable payroll. Last year, it was a minus 3.50. So a definite worsening in the actuarial balance, which is the measure of, one way to think about it is how much more in payroll taxes would we need to be solvent over 75 years? That's not exactly right. There are a couple of nuances there, but a good way to think about it is if we increased the payroll tax rate by about 3.8%, that would put the combined trust funds in the position to be solvent over the next 75 years. And for those of you interested in the detail, these are the various factors that contributed to that change this year. Just another way to look at it. This is a graph that shows the trust fund ratios. Most of you are probably familiar with this measure. This is just the trust fund reserves as a percentage of the annual cost for the year. So when you see those trust fund reserves drop to zero, that is the year of reserve depletion. A few things to note here. The DI fund is in the blue. You can see last year's projection and this year's projection. Obviously, DI is in great shape over the next 75 years. OASI by itself is these red lines, and OASDI combined is these black lines. So we are in the 2033, 2034, 2035 range right here. Tax rate reallocations in the past, you'll notice that in the mid-90s and in the mid-2010s, the DI trust funds were fast approaching reserve depletion. At that time, the Congress decided to make a small tweak in the tax rates reallocated to the programs, which increased the reserves for DI for a while here, and then forever, basically, after 2016. Could there be another tax rate reallocation, maybe going the other direction? It is possible, but one thing to note is that the OASI reserves are so much bigger than the DI reserves that reallocating some from OASI or from DI to OASI would not have nearly the big impact it did as going in the other direction. All right, I am going to move very quickly through these next couple of slides. This is, I think, just about everybody's favorite graph. It very clearly shows the difference between the interest income coming in each year. I'm sorry, the non-interest income coming in each year, which is very stable at about 13%. And then the blue line is the cost of the program. So you can see that since 2010, the cost to the program has been higher than the income to the program. And that's why the reserves are decreasing. That's why we are expecting reserve depletion in a while. This dotted line up here shows the cost of the scheduled benefits to the program. However, once we reach 2034, the program can't pay out the full scheduled benefits. It's got to drop down to the income that's coming in. By law, that's all the Social Security trust funds can pay out. So the difference between these blue lines is really the gap that's got to be solved in the future. This box down here shows what is payable upon reserve depletion. So for example, in 2034, we've got about 81% of benefits payable. That's relatively stable as we go forward. You've got some ups and some downs, but by 2099, we're at about 72%. So while that isn't great, it is by no means 0% of benefits payable. And hopefully all of you are spreading that word to folks you know. 2034 is not the end of Social Security, although benefits will need to be adjusted in some way. All right, how do we eliminate the Social Security long-term deficit? It's a simple math problem, a difficult political problem. What we need to do is make choices addressing the shortfall from 2034 to 2099. We can do that by raising scheduled revenue by 2034 by about 1/3, decreasing scheduled benefits by about 1/4, or some combination of the two. And it's really up to our politicians and all of us to figure out what combination is the right one. Finally, long-term projections, as in the trustees report, provide information to assess the solvency and the changes needed. If the trust fund reserves were to become depleted, as mentioned already, full benefits could not be paid timely. There would be no pressure on the budget or federal debt because Social Security is off budget. So Congress really needs to act, as it always has. And as mentioned already, there's straightforward solutions on a math basis. On a political basis, it may be challenging to get there. Finally, just a quick advertisement for our website. You will find the 2025 and all prior trustees reports there, and many other pieces of information that will be useful to all of you, including this presentation should be there later today. So with that, let me stop sharing and I will turn it back over to Mark.
Karen, thank you so much. We're so excited to basically have one of the very first events that you've done as Chief Actuary. And that was a really helpful, useful presentation. So thank you again. You can feel free to turn your video off if you'd like. I'm really excited to be here. Not only were we able to have the brand new Chief Actuary of the Social Security Administration, but I'm now really happy to have our brand new Director of Social Security, Mark Sarney, here, and our pretty darn new Director of Healthcare, Anna Bonelli, here. And the three of us are going to have a little bit of discussion about the trustees report and all of the great findings. And I'm going to start with you because Karen talked in great detail about the Social Security trustees report. But of course, there were two trustees reports that came out last week, as I think all of our staff knows, having worked till midnight going through them. Can you tell us a little bit about what we learned from the Medicare trustees report?
Yeah, absolutely. So we looked really closely at the Medicare Hospital Insurance Trust Fund, and we found, as Karen pointed out, the trust fund is scheduled to be depleted in 2033. So same as Social Security, which makes it easier to remember, but is nevertheless just as dire and just as concerning. This represents 3 years earlier than the projection from last year. So things are worse than last year. Once the trust fund is insolvent, we've just got the difference between revenues coming in and benefits going out in terms of reimbursements to hospitals and hospice and other providers that are paying for services for our 68 million beneficiaries. The trust fund in 2033 should be able to pay out 89% of its obligations. So, unlike Social Security, when it comes to the hospital insurance trust fund, it's harder to know what will happen. It's not an automatic cut to, this hospital or, this payment or something. It doesn't go into the pockets of beneficiaries like Social Security does. Instead, CMS, the federal government, will have to make some really hard decisions about what to do with those funds. Overall, and I also want to just point out that 2033 is just the beginning. 2033 is when the real pain starts, but that's going to continue for years to come. By 2049, the deficit won't be 11% like in 2033. It will have grown to 14%. So now we're looking at having to deal with a 14% cut to reimbursements to hospitals, reimbursements to managed care, Medicare Advantage plans, et cetera. And just remember that things can always get worse. As Karen pointed out, the trustees look at the range of assumptions and they choose, what is reasonable within the range of assumptions. The Office of the Chief Actuary at HHS also takes a look at this, and they run alternate scenarios. And, their scenarios are not as rosy as the trustees, even as dire as that sounds. So one thing that the Office of the Actuary thinks about a lot is the fact that Medicare does an okay job. The federal government does an okay job at controlling the costs and holding down the rate of growth of expenditures for the Medicare program. The federal government does okay at that. The federal government doesn't have runaway costs when it comes to paying for hospital and other provider costs. But that pressure to increase reimbursements for hospitals, hospice, et cetera, over time will grow. And so the chief actuary looks at all these different assumptions and says, like, well, what if Congress caves to the pressures from all these different providers and increases reimbursement rates sometime in the future. If that happens, they project that gap between revenue and reimbursements or costs could go to 3 times as high as the trustees report. So that is definitely concerning. And so this is just a really good reminder that, 2033 is a really important date, but we should be acting now because we have a long way to go with this program.
And I'm going to ask you a quick follow-up question, Anna, because you just talked a lot about the hospital insurance trust fund Part A, but the trustees also talk about Part B and Part D a little bit. So what do they say about those other parts of Medicare?
So those parts of Medicare have a different funding arrangement. For the most part, so the trust fund under which they are funded is not limited, doesn't run out of money in the same way that the hospital insurance trust fund runs out. The trust funds for Parts D or for Parts B and D, which covers physician payments and outpatient drugs and prescription drugs, is funded annually by the federal government, so it doesn't run out in the same way. Nevertheless, the biggest increase over time is going to be seen in Part B. So those are payments to physicians. Part B payments, like if you look at the graph, it's really easy to see, but the Part A payments kind of truck along. They're pretty well controlled at a pretty low rate of growth. But when it comes to Part B, it grows at quite a bit faster rate of growth. So if you remember, doc fix, right? Like every year for years, Congress is always dealing with what do we do with physician payment, because the way that Medicare pays physicians was some would say underpaying physicians for some amount of time. Congress would come along every year and do this doc fix thing and like add on an extra percentage point. Congress is going to be facing that again soon because these costs costs compared to reimbursement are going to continue to grow.
Thanks. And I just want to remind folks that are tuning in at home, if you go to the Q&A section of your Zoom, you can send us questions. I have this little iPad right here, and I'm going to try to read those questions along with our other discussion. But I want to go to you now, Mark. Welcome to your first official CRFP event.
Thank you.
Seems like 2033 is a pretty important year, at least at least when it comes to Social Security and Medicare. What exactly is going to happen?
Well, part of the really scary thing is we don't really know. So a number of different things could happen. And as Karen mentioned in her presentation, we had, even though the year didn't change, there was a 3/4 difference in when during 2033 the Social Security Trust Fund might be depleted. That kind of uncertainty means that there's any number of different scenarios. But let's say both Social Security and Medicare are depleted 3 months into 2033. Since you said it was about 3/4 earlier than it was last year, there's going to be a newly inaugurated president in his or her first couple months in office and a new Congress. And if they don't act, Social Security checks are going to have to drop by about 23%. And if Medicare can't reimburse hospitals, we're not really sure what's going to happen, or Medicare Advantage plans. But like a typical married couple might lose somewhere around $17,800 in annual benefits from Social Security, and their hospital may close. Or maybe they've got to pay more for a Medicare Advantage plan. If that all happens, both those things happen at the same time, we could really have a national calamity on our hands, because the size of Social Security, as far as providing support to seniors and the disabled, and children who've been orphaned by parents who've died early, that means like roughly 1% of the economy stops and going out. And that hit to consumer spending, in addition to what happens with Medicare, could hit the economy, the political system, the whole country, in a double whammy, unless Congress and the new president or re-inaugurated, new term president acts. So,
I think we need a name for this, because we've had the fiscal cliff, right? Is this the retirement calamity? I don't know,
right.
but
We will
we're
work
going
on
to call it. Yeah. By next year, we'll have that.
trust fund trapdoor.
We'll have that ready. So I'm going to go to you again, Mark, and then to you, Anna. But Karen talked about this a little bit, but what's changed since last year? But then also, she showed us back to 1991, and it looked like things were in much better shape back then. We were going to be into the 2040s, and even 15 years ago, we've shown, the solvency shortfall was like half as large. So what's happened since then?
A couple things have happened. So about half of the kind of deterioration that's happened just since last year's report came from a change that was enacted by Congress and the prior president just in December, after the election happened, that increased benefits for state and local government retirees who are already getting a Social Security-like benefit from their state and local government employer. And this boosted their benefits, but it also means that the Social Security Trust Fund becomes depleted sooner. There was also, as Karen mentioned, changes to some of the assumptions. Fertility is one that people are not having as many children as was expected. And there was, for years, people have been saying that fertility assumption was too high, and they've kind of knocked it down a little bit. And that means that there's fewer future workers. And as you mentioned, the wage base is growing more slowly than total compensation. And that was, I think, something that they didn't really see coming as much as it, at least to the extent that it's happened. So those three things have really combined to nudge the insolvency of the old age trust fund a year earlier.
Yeah, and the same question to you. What's changed in the Medicare, right? So the old age trust fund lost 9 months or 8 months or something, but the Medicare trust fund lost several years, right? So what happened to make that worse?
The Medicare trust fund is a little bit different in that it's smaller, and so it's more sensitive to changes, right? So we've got, even simply in the last year, a modest increase in expenditures for hospitals and hospice care is part of the reason driving that increase. The moving up the solvency date by 3 years. We've got baby boomers who are who are just at the tail end of baby boomers are moving into the window where they're going to start qualifying for Medicare benefits. So that is a significant increase in expenditures. People are living longer. That is something that we all understand. Medicare, all health insurance costs are highest at the end of life. And, Medicare plays an extremely important role in that. But that drives a lot of cost. And we also learned that outpatient spending will continue to grow rapidly. So a lot of factors combining, but Medicare, the Hospital Insurance Trust Fund is sensitive to changes.
So we're getting a lot of good questions coming in, more than I think we'll be able to cover. And so we'll try to get to your question. If not, feel free to email us. But I'm going to start with one that I'll go to Mark and then to you, Anna. But while last week we had a very exciting Trustees Day, mostly we've been focused on, and Congress has been focused on this big reconciliation bill, the One Big Beautiful Bill Act, right? And it's passed the House, it's working its way through the Senate. How's that bill going to affect Social Security and Medicare? Let's start with Social Security.
Well, so the reconciliation bill, according to Senate rules, cannot touch Social Security directly, but it can have indirect effects. So, for instance, there's a taxation of Social Security benefits that is done through the income tax system, and that revenue is part of what feeds into the Social Security trust funds. If that bill reduces taxation of benefits revenue, it could make insolvency happen a year earlier or some number of months earlier. And it could happen in two ways, according to the way the bill is structured now, which is a higher deduction for seniors and just lowering the income tax rates. So those two things could potentially make the problem worse. And then there could be other effects beyond that. But if that were to happen, if we slide another couple months into 2032, that means we could have a 23% reduction in benefits happening in the middle of a presidential campaign, which sounds not optimal.
And how about for Medicare?
Yeah, same kind of thing. Lower revenues means lower payroll taxes, or people paying into payroll taxes means lower revenues for the trust fund. So that's going to reduce the amount of money going into the trust fund. Unlike Social Security, though, Medicare is something that could be subject to reconciliation, but has not been, or has not been to a very large extent. There's a couple little tweaks to Medicare. I won't go into, they're fairly minor as far as these things go. But as we've seen, congressional and administrative leadership have wanted Medicare off the table. There was like a moment last week or 2 weeks ago when everyone was saying, maybe we could include Medicare. And then it seems like that has kind of fizzled out. So, we think that that's really a shame. It's a tremendous shame. I mean, this is a program that overall costs $1.1 trillion per year. 2024 total expenditures for Medicare, $1.1 trillion. This is the largest program that could be subject to reductions under reconciliation. And there's a lot of opportunities to cut costs. There's a lot of waste and abuse in the program. And so we would really like to see that momentum reignited.
So what I'm hearing is that even though we're warning you about the scary 2033, actually it could be a scary 2032 for both of these programs. And Congress, despite having the opportunity, is doing nothing to improve the Medicare side. But I have another question here that I think kind of relates to what you said, which is somebody asked, what are the bipartisan savings options that could be used to help restore Medicare solvency? I'm going to adjust that question a little bit to just ask, what are the easy Medicare savings that they should be looking at, in reconciliation or elsewhere?
Yeah, I love this question. So many. The number one thing that has gotten bipartisan support is site neutral payments. So for those of you who are here for Social Security, I'll explain. Hospitals and doctors' offices are often getting paid different rates for the same service. So person goes into their local clinic, they get one service. If they were to have that exact same service at their outpatient department of a hospital, the hospital will be reimbursed significantly more. So there's all kinds of proposals on the table, including one that was passed by the House last year, that would equalize that payment so that for the same service, providers are receiving the same payments. This is fairly dialable. You can limit it to like this kind of service and not that kind or whatever. There's different ways to do it, but the savings opportunities could go as high as 150 billion over 10 years, according to CBL. So that's a real opportunity. Another one that has become more and more bipartisan of late relates to Medicare Advantage. So again, so Medicare Advantage is, private plans administering Medicare benefits. So private plans contracting with the hospitals and the doctors to pay for people's care. The thing about Medicare Advantage is that the amount that Medicare is paying for each beneficiary who is in a Medicare Advantage plan is way more than for fee-for-service or what's called traditional Medicare. There's a lot of reasons for this, a lot of technical reasons. Main reason is that MA plans, Medicare Advantage plans, are very good at making sure that they get reimbursed for every single diagnosis attributable to an individual. And so there's all kinds of like technical ways that we can deal with this to equalize so that we're not overpaying for beneficiaries who are really at the same risk level as those in traditional Medicare. There's a million different tweaks to the system that we can employ, and it's completely scalable, dialable. You could do a small tweak and save $10 billion. We calculate that the overpayments to the Medicare Advantage plans could be as high as 1.2 trillion over 10 years. So, there's a lot of cost savings there that are being left on the table.
Then what about Social Security? I can see a couple questions here about the income cap and the retirement age, but what are some of the options to restore Social Security solvency?
Well, Karen mentioned that there's essentially two big categories. There's changes to revenue and there's changes to benefits. So, but there's also opportunities for sort of win-wins that would allow changes that are least harmful to beneficiaries or least harmful to taxpayers. And there's been a lot of proposals. I'll put a plug in for the actuary's website. They have a lot of those posted that they've done scores for and describe in a lot of detail. But there's a lot of possibility to come up with options that can encourage longer work careers, that can help people make more informed retirement decisions, and that can better protect the economically vulnerable. So there's entire subcategories for each of those, including increasing the cap on how many earnings are subject to the payroll tax. And that alone wouldn't close the 75-year deficit. So almost nothing would close the entire problem. It's probably going to have to be a package that can get through Congress and probably be a collection of benefit changes and revenue changes, as Karen mentioned.
Yeah, I'll just do a quick plug for, we can put it in the chat, for socialsecurityreformer.org, which is our interactive tool where people can kind of design their own plans. And I know, we've used it in high school classrooms. We've used it with members developing legislation. So like everything from high school all the way down to members of Congress, anybody can use this tool, and it's got a lot of these great ideas. I also realized I didn't really introduce you guys at the beginning, but I do think that it's important to acknowledge that the tremendous amount of expertise here, because Mark essentially has been head of research in one way or another at SSA for 20 years. The office has changed, Office of Policy has changed names.
Yeah.
It's actually the head of research. And Anna has worked at GAO, at CMS, and the Finance Committee doing healthcare, and has expertise both in Social Security, Medicare and Medicaid. And she's gaining expertise in Social Security working here at CRFP, but Medicare and Medicaid, so against her will. Yeah. So just really excited to have both of you here. One question that I have a few questions that go mixed together, but a lot of people are asking questions about immigration, both about what's changed in the current report, about whether it includes the recent changes in immigration policy from this administration, and about what the recent changes in immigration policy, the deportations, the closing of, or the increased border security, et cetera, what it would mean for Social Security and Medicare. So I don't know if either of you can opine on that at all, but there's a few questions in that to that effect.
I think I can weigh in. So Social Security is kind of in an interesting position. There's a lot of talk that somehow Social Security is on the losing end of having immigrants, either legal or undocumented, that are here working, and it's actually the opposite. So Social Security is roughly receiving somewhere around $24 billion a year in payroll tax revenue from undocumented workers that they can't collect benefits on. So in a sense, they're here working and they're gifting the trust funds $24 billion a year. There's only three ways we can have more workers in the future: more babies now, immigrants, and for current workers when they get older to continue working. So to the extent that immigration drops, Social Security is going to be in deeper trouble.
Maybe do that for Medicare?
Well, just similarly that when people are working and paying taxes, they're paying into taxes for the trust fund. And so, that extends the solvency date. I just would also add that, we have an extreme healthcare shortage of healthcare professionals in the US, both doctors as well as, home health aides and LPNs, et cetera. And a lot of these jobs are filled by qualified immigrants. And so limiting the influx of those folks could help to drive up costs because, the remaining providers can charge more and just decrease access for our beneficiaries.
How big an issue do you think, this is sort of a mixing couple of questions again, but is waste, fraud, and abuse, both in Medicare and in Social Security? Can you give any examples in either? Maybe we'll start with Medicare.
Oh yeah, I mean there are so many ways to look at waste, fraud, and abuse of the program. First of all, I think it's important to distinguish fraud is illegal and happens, needs the involvement of lawyers in order to prosecute. Okay, and so typically fraud cases happen, they're deliberate and often can be really big dollar. So this is where you get your Office of the Inspector General and your DOJ attorneys, and they go after and prosecute. And there's a lot of the limiting factor in some cases is not identifying it, but actually like prosecuting it. And then when it comes to waste and abuse, I mean, the line is very gray between what's wasteful and what's abuse. But basically, CMS has all kinds of programs to go after fraud, waste, and abuse, but there's always more that can be done. I mean, as I pointed out before, a lot of people would say that the extra payments that Medicare Advantage plans receive to reimburse for the same risk level of beneficiary is a wasteful amount of spending. So, you could definitely make the case that it's a waste to pay more for a beneficiary just because they flip over from traditional Medicare into Medicare Advantage.
And we have seen some press that some of that is literally fraudulent and that they're sort of lying about the risk pool to some degree as well, right?
Yeah, well, right now there are initiatives underway, like DOJ is prosecuting at least one major plan on that very issue, and that's true. On the other hand, a lot of it probably falls more into the waste and abuse category, where they are taking advantage of loopholes in the system in order to extract more dollars.
How about Social Security? There's also a lot of waste, fraud, and abuse in Social Security.
No, much less than advertised, I think. So as a percent of all the benefits that are paid, the amount that are improper is really low, something like 1% or less. And Social Security has a bunch of, kind of like Medicare and Medicaid, a bunch of internal controls, Inspector General, GAO, the Government Accountability Office, as well as kind of inside the agency, there's a lot of folks who work on figuring out, is there something going on between a employee and a beneficiary? Is money going out the door that it shouldn't? But in addition to that, some of the improper payments that are not fraud, waste, or abuse are often very short-term things. For instance, if someone passes away and we've paid them a benefit, usually that is recouped very quickly once the death date comes into the agency. Or if people have to report their earnings on a monthly basis, sometimes Social Security field offices are overwhelmed and they lose the report, and then there's an overpayment. or an underpayment for, say, children who are eligible for parents on a deceased parent's record. You know, they may be underpaid and have to be paid a bigger lump sum. So those things are really small and kind of on the edges. To echo Anna's point, you know, deciding that like certain benefits that are legitimately going to people are waste could be in the eye of the beholder. And that's a totally different category than actual legally actionable, you know, prosecutable crimes.
So very low fraud and abuse, waste, eye of the beholder.
Yeah.
Okay. This is an interesting question that's probably going to take you both by surprise, but I'm hoping one of you has a good answer. But what impact do you think AI is going to have on either the way that benefits are delivered or the sort of need for them, and because of how it deals with, you know, how it affects the labor force and joblessness and things like that?
So tough. I mean, well, you go.
Okay, I will go first. AI gets talked about a lot. To some extent, it's not going to wipe out all jobs in the economy or anything like that. AI kind of was already here for a while. It's being used more than it was in the past, and it's getting better. But you know, for anyone who remembers old-fashioned Microsoft Office, there was Clippy, and to some extent, AI might just be an improved version of Clippy for a lot of folks. Now, could the agencies use AI? Sure, and they already are. But I don't think we're going to see massive changes in the labor force, just like we haven't seen, you know, robots take over white-collar jobs, and we're still not getting flying cars that don't need a driver. I mean, there's a bunch of these things. We've seen a lot of things that are like everyone's going to be a gig worker in the early 2000s, and that didn't take place. So I kind of think it's a little bit of a fad.
Okay.
That
So
won't
if
have this big effect.
so, Mark thinks AI is not going to take our jobs, but can AI replace our doctors or our nurses or our medical technicians or our radiologists?
I think what the trends for healthcare have always been when you like improvements in technology leads to higher costs. So we have, you know, the greatest technology in the world. It's amazing. It does incredible care, you know, particularly acute care, but it doesn't reduce costs. So AI, you know, I could just see this cutting both ways. You know, the right now it's still very fragmented. You know, you could have better diagnoses. Okay, great, but then people still need treatment. You could have, you know, you could have AI improving fraud, waste, and abuse. You know, possibly, but like I said, I still think that CMS and the various entities do a really good job of picking off some of the big things. And they need more tools in order to actually stop that money going out the door.
Plus, you may have other AI that's committing
Exactly.
waste, fraud, and abuse. Right?
Exactly. So, you know, like the big example of Medicare Advantage, you know, maybe AI would get better at like adjusting those risk scores for different people. Like that's really cool. But, you know, those who have an incentive to increase the risk scores have, you know, just as sophisticated AI, maybe that's, you know, I don't know, robot battles or something. But like, so I think the jury is out.
Yeah, I would say like for health diagnoses, there could be a huge improvement due to AI. And I've seen when I worked at Social Security, there was a lot of data analytics driven by AI that was finding potential fraud, waste, and abuse, or better prediction of who would qualify for disability benefits, which is really difficult for humans to do. But I think anywhere where it's been deployed, generally, there's still a human involved, whether it's weather prediction or producing, you know, content on the web. There's still humans in the mix, and often it just becomes another tool. It doesn't replace the person using tools.
We've had every time a politician has tried to reform Social Security, reform Medicare, it seems like they've been beaten back. And in Social Security, you know, it's called the third rail of American politics because, you know, Reagan tried to do it in 81 and he got destroyed, although he came back in 83 and did it. And, you know, Bush tried to do it, Clinton tried to do it, et cetera. In Medicare, we call it the Mediscare, right? And here it just feels like both parties actually support the same policies. They just take turns who's the one that is trying to pass it and who's the one that's trying to attack them for it. But like, why is this so demagogued? And what can we do? And what can folks out there do to like turn the temperature down?
Yeah, I think it's a really good question. It's really hard. It's partly why we're here and we exist. But yeah, for me, I think that it's about money, like somebody has to lose in order for these programs to continue doing their job well over many years to come. So, in Medicare for the Hospital Insurance Trust Fund, if it runs out, like hospitals take a hit. Well, so to restore that, we either need more revenue increases or we need to take money somewhere else out of the Medicare program, which we don't have the authority to do. But, somebody has to lose. Is it hospitals? Is it doctors? Is it other types of providers? Is it beneficiaries where maybe we need to increase cost sharing? So none of these are, really palatable options. They all have very strong advocates who do a great job of lobbying on behalf of their interest. And so every time you want to make an adjustment, if something goes up, then something else has to go down, and that's really hard.
How about Social Security?
Well, part of the reason why both these programs are so apt to be subject to political discussions that hit on people's fears is because they're so important to people. For Social Security, for a lot of folks, it is their primary source of income when they are aged or disabled. And Medicare means whether they get health coverage or not. So that's why people really sit up and take notice when any discussions about Social Security or Medicare take place. But part of turning down the temperature is, in some sense, is telling the truth about what these programs do, what the problems are that they face, and then what the possible options are to fix them. It might be that the public and the policymakers are much closer than either side thinks, but there's always other things happening, so it's a convenient excuse not to pay attention to it. But if people go and use the Social Security reformer, for instance, if you think that an option is all that the policymakers need to do and they don't want to do it, and you don't see the option on the Social Security reformer, chances are it's not a real viable option. So one of the things that's been kicking around for years is Congress needs to pay into Social Security. They're never going to fix it unless they pay in, but they've been paying in for 41 years now. So things like that, if we can educate the public about how the programs actually work and the solutions that are available, sort of the menu, the public already kind of has some preferences for how they want this to be done. And to some extent, for policymakers, the public can help the policymakers get to that point of actually taking action. So it's a lot of the low-level grassroots stuff of talking to your elected officials, talking to your neighbors, getting people to play with the Social Security reformer. And I believe people can email their solutions to the committee,
Yeah.
and we keep track of what people are choosing. But the other thing is policymakers need to realize that this isn't all a terrible story of how do we fix these programs. There are opportunities here to improve both, to better serve the people who've paid into them. And, elected officials like to provide good benefits to their constituents. And in some sense, it doesn't need to all be forcing people to eat cauliflower. You can also give them cookies. But if you want to maximize the cookie to cauliflower ratio, you need to do that sooner, because if we wait till 2033, it's going to be mushy cauliflower no one wants. And it's probably going to be ugly. So, but elected officials are really afraid to have to do anything that looks like it's going to hurt these programs, again, because they're so important to people.
Yeah, I just have to say, I definitely prefer mushy cauliflower to the crispy cauliflower.
Yes.
No, cookies are better, but I actually prefer mushy. So I don't know if that was supposed to be the worst cauliflower or the better cauliflower.
Mushy
But,
is usually worse.
I like it better mushy. But you said before, did you say 17,000? What was the number you said?
$17,800 in annual benefits for an average earning dual or married couple.
Okay.
a
So
year.
if we do nothing for 8 years, a couple that today is 59, they're both 59 years old, right? They come along to collect their benefits at 67, and their benefits are almost $18,000 lower combined than they thought they'd be over a year. And maybe they can't see their doctor because Medicare's run out, right? That feels like that should be motivating. How do we get that message out? And that's sort of a rhetorical question, but let me ask another one that's maybe less rhetorical, which is like, why now? Why do we need to act now? Why not just wait until the year before and make the adjustments then?
Well, I think recent history is a really good reason why. So, for instance, when there was a budget agreement in 2013, the worst case scenario was that sequestration, which was across the board, funding reductions would happen, and this was going to force everybody to come up with a better plan. And what happened was there wasn't a better plan that was passed, and so sequestration happened. And we keep having these worst case scenarios happen. So the worst case scenario is that there's a trap door with a clock ticking down from 8 years from now, and it's actually going to be shorter than 8 years in a sense, because some of those are election years and we can't expect action to possibly happen in any one of those 8 years and so forth. But that trap door opens and you're going to have senior citizens, their kids, everybody falls through it, whether it's Medicare or Social Security or both at the same time. And I think we can make that point come across that if you make changes sooner, it's not as big of a hit, whether it's on the revenue side or the benefit side. The longer we wait, the worse it's going to be. So in some sense, it's one of those like rip off the Band-Aid now, because we can do this cheaper, less painful, and time is, ticking. The committee has a countdown clock on its website that shows how much time is left, and
crp.org.
And you can kind of see that the longer we wait, the worse it's going to get. And now we've seen from the trustees reports that the date of insolvency is not really changing. It's not like we can expect that there's going to be some economic boom and suddenly we won't have to worry about it until 2099. That's just not going to happen. It's it's 2 presidential terms away. It's 1.33 senatorial terms. Like, people in office now are going to have to face this most likely.
And I'll just add one thing, which is that we've seen a lot of research out there that people actually really benefit just from certainty over their benefits. So they'd be willing to give up something like 10% of whatever the benefit is just to know what it is so they can plan and adjust their retirement behavior and savings and things like that.
Right.
How about in the Medicare space? And not just like why act soon, but like where are the win-wins? What's the positive message out there besides we're going to take from the hospitals to give to the beneficiaries or stuff like that?
Yeah, I think the message is essentially the same, that acting sooner leverages the miracle of compound interest. It will make the pain less. The longer we wait, the more painful it's going to be. And when it comes to Medicare, there are so many different dials and levers that can be adjusted in order to, kind of reduce that cost curve, eliminate waste in the program, where the pain on the expenditure side could be shared in an equitable way. And so I think this is totally doable. I think that managing this problem is very doable, and we just have to get to work.
Great. Well, that's exactly what we're doing at the Committee for Responsible Federal Budget. So I'd encourage everyone to check out our website where we have tons of stuff on Social Security, on Medicare, also on Medicaid taxes and other budget and budget related issues. And we're going to keep working at this for 8 years if we have to, but hopefully a lot less, because hopefully we're going to solve this in the next couple ones. And for those of you that want to applaud to an empty computer in front of you, please join me in thanking Mark and Anna, who are just an amazing panelists, and Karen for joining us and really giving us the details of the trustees event. So thank you all for attending today.
Thanks.